Patients who have breast cancer who go through treatment can experience a number of changes in self-image, changes that are both physical and changes that are emotional. Just going through surgery itself can be difficult. Surgery usually means either having a lumpectomy and radiation or a mastectomy. If a woman has a mastectomy, it is frequently, but not always, accompanied by reconstruction. But as you can imagine, those changes in the breast, in and of themselves, result in changes in self-image, in the way a woman's body feels, and the way she may look both with and without clothes. And how women react to that really varies a great deal. Some have very little difficulty with it. Others, perhaps people who have been more concerned about their body image right along, sometimes have more difficulty with it. The other two parts of therapy that can have a major impact on body image are hormonal therapy and particularly chemotherapy. With hormonal therapy, the biggest problem is that oftentimes women develop hot flashes, which can themselves have an impact on body image. And sometimes for premenopausal women, we consider treatments that make them postmenopausal, which as well can affect body image. But it's really chemotherapy more than anything else that's the big hit in my view. So a woman often loses her hair. Sometimes, depending on the chemotherapy, she loses her eyebrows and eyelashes as well, which sometimes is even harder than losing your hair in terms of the way it makes you look. A woman can lose weight. More commonly, she can gain weight, something that's always surprising to people. And this, of course, is happening on top of the changes that may have already happened or will happen in terms of the breast. So from a physical standpoint, it's pretty tough to go through this treatment at times, not to mention the fact that while you may have a change in body image, you also don't feel that good because the treatment itself can make you feel ill. Beyond the physical issues, then there's the whole emotional side. And going through breast cancer treatment because of the changes in the breast, because of hair loss, because of just feeling like you don't look as good, may make a woman feel less feminine, may make her feel like she's just not presenting herself to the world the way that she's used to. And as a result of that, sometimes people become down, sometimes people become frankly depressed. But I think the first step is to talk about it and to get the support that you need. Oftentimes that support is available through family and friends. Humor works well for a lot of people. Simple steps, for example, if you're going to lose your hair, like cutting it short before you lose it and so that you're not losing long strands of hair, is often very, very helpful for people. But sometimes it's just not enough to talk to family and friends. And when that happens, of course, it's possible to talk to your oncologist and your oncology nurse and the social worker who works where you're receiving treatment. And sometimes people need more than that. They need to spend time with a mental health counselor or with a psychiatrist or a psychologist or a licensed social worker. And sometimes medication is needed as well. I mean, that's really when someone's feeling depressed. And this is also a setting where talking to people who have gone through the experience can sometimes be helpful. There's another way that people can help themselves, which is trying to maintain their lives in as normal a state as possible. I think that is something that we tend to underestimate in terms of importance. But going on with your daily life is something that really helps people get through. And finally, I think if someone can, continuing to exercise or starting to exercise is often something that's very good for body image. It can help keep one's weight under control, and more than that, people say time and time again that exercise helps one keep one's spirits up. There are a variety of different sources for information about coping with self-image changes. Again, you can talk to your doctor, you can talk to your nurse. There are books available, oftentimes in the cancer center where you get your treatment or in the library. Go to a site like Cancer.Net that has been reviewed carefully, where there's a great deal of attention paid in terms of the content, because otherwise you just don't know what you're happening upon.